we wanted to list the symptoms, which is, we've talked about the painful periods, we've talked about the heavy bleeding, we've talked about the infertility, also sexual intercourse pain. But because of this connection between the bladder and the bowels and other organs, then we can also get bowel pain, we can get IBS, IBD, and bloating, nausea, fatigue is really common. It's incredibly stressful for the body. Depression, anxiety, we make those connections from a hormone perspective. Also thyroid conditions. There's a real hand in hand with how the thyroid works with female hormones, and when there are endometrial cells that are inflamed and growing, then it is affected by TSH levels. There is this one of the questions that you can ask when you are seeing case studies, if you've got someone with endometriosis, is just ask those questions around thyroid. So things like metabolism, temperature, cold hands and feet, a slow digestion, a quick digestion. So there's these kind of thyroid symptoms can also go hand in hand with endometriosis. There's also this 40% increased risk in cancer for endometrial, cervical and thyroid cancers for women who have endometriosis, because it is a dysfunction of the immune system. And symptoms can improve. I can't see the bottom of my slide.
After menopause.
Thank you very much. And we will look at why that is. I mean, the main reason is the estrogen connection, as estrogen starts to drop off. But then we have this real issue, which we're going to talk about more in this presentation, is we need estrogen. So when a woman's going through menopause and the estrogen drops off, maybe the endometriosis is improving, but then you've got all of these other menopausal symptoms that are estrogen related. So what does a woman do?